Minister, just in respect to the implementation stage, I raised in my second reading around Indigenous Navigators, and I noticed in the second reading response you touched on it, but I just wanted to understand a little bit further what that's going to look like in respect of each area, who will be guiding that conversation, and will all Indigenous stakeholders be invited? And then, yeah, I'll start with that one.
Minister.
Thank you, Mr Chairman. So, Honourable Member, it is intended that during the 18-month implementation period there would be extensive and detailed work with Aboriginal communities and indeed Aboriginal health services. And I think during that phase that will enable the development of appropriate models of cultural, spiritual and practical support for Aboriginal people and their families who choose to seek information about or access to voluntary assisted dying. The Department of Health would build on the consultation that was already undertaken by the Ministerial Expert Panel and work closely with a range of stakeholders, including the Aboriginal Health Council of WA, Aboriginal Health Services, WA Country Health Services, other health service providers and the WA Primary Health Alliance. As recommended by the Aboriginal Health Council of WA in their submission to the Ministerial Expert Panel, the Navigator program would be planned, designed and implemented in a culturally appropriate way, and suitable training and ongoing support provided to care navigators. Community awareness and communication programs about voluntary assisted dying would also be developed to ensure that everyone in the community, including Aboriginal people, has accurate and appropriate information about this choice. So that is our intention, and certainly the detail of that will be fleshed out during that 18-month implementation phase, but certainly the commitment is to work in partnership with Aboriginal organisations to make this work culturally for those people.
The Honourable Kyle McGinn.
Thank you, Chair. Yeah, I appreciate that, Minister. I suppose there has been some commentary outside of these walls in respect of the Navigator role, pushing people through the process, which has not been the intent of what I have said, and I believe not the intent on what the government has responded. And just correct me if I'm wrong, but the Navigator role is there to ensure that they understand the process they are going through, as you said, culturally as well. It is simply to ensure that they are not misunderstanding the process and falling through a gap. I just want to clarify that the intent is to assist people who want to go through the process, not coerce people through the process.
Minister.
Thanks, Mr Chair. That is certainly the intention. And of course, as was alluded to in the second reading phase of the bill, Aboriginal people are not an homogenous group, and certainly we will ensure that there are several different approaches developed to ensure that needs are met across different Aboriginal communities, because what may work in one community may not work in another. What may work with one family group, indeed, may not work with another. So for some people, care navigation may be provided by Aboriginal health services or Aboriginal health workers in their community. For other, or in other circumstances, dependent on the patient's preference, or where services or workers in the community are not able to provide a care navigation service, other options will be made available. And so those options will need to be developed through collaboration and consultation with Aboriginal communities, with the aim being to ensure that the patient and their family receive culturally appropriate support. So it's about providing an option, but certainly not pushing people.
Mr Chairman.
Now, there's a number of members seeking the call, and one way or another everyone's going to get a go. We can stay here for as long as you like. The Honourable Kyle McGinn, the members are deferring
I've just got one more
yeah.
to go. No, thank you for that, Minister. That gives me some peace of mind. I just want to make sure also one of the key things that seem to happen is people come from another area with cultural competency courses, someone from Perth, for example, and that's deemed to be appropriate culturally out in areas such as communities, and there is plenty of them in my electorate. I just want to ensure that these discussions will be based around ensuring that they are as local and as close to culturally appropriate, rather than just saying we have someone who's culturally competent that we bring in from Perth to fill a gap. And if there is a gap on people who on people being able to provide the navigator role locally, will the government ensure training is done to ensure that the most appropriate culturally respectful person in that area will be able to perform that role?
Minister.
Thanks, Mr. Chairman. We're certainly committed to ensuring that there is culturally appropriate services available to people who want to access this. Some people, including Aboriginal people, may not want to access services locally, and indeed may not want to have local people providing assistance or helping them navigate the process. So it is a difficult. It's a difficult area to give you kind of a, absolutely, we'll just give you a local person and they'll help you get through the process, because somebody might not want that. So our commitment is to ensure that during that implementation phase that we are working through all options to ensure that the service that is provided is appropriate for either the people in that community or the people who want to access the service.